morning, everybody, and welcome to Ottawa Plastic Surgery. This morning I would like to discuss abdominal and body contouring. Abdominal contouring is a very popular procedure that is performed by myself and Dr. Boyd here at Ottawa Plastic Surgery, and we've received a lot of questions, so I thought it would be a good topic to discuss. When considering abdominal contouring, people seek this operation for a variety of reasons. Some seek this operation after weight fluctuations. Some people have noticed changes after pregnancy or after surgery or substantial weight loss. Additionally, some people seek abdominal contouring to correct scarring and distortion of the abdominal shape after surgeries. So how do we decide what's the correct operation, the correct procedure? I like to divide the abdomen into its individual components, and this will allow us to come up with the safest and most predictable operation for each individual patient. As such, the operation is always custom, it's always individualized, and it's always unique to each individual patient. The first thing I like to consider is the patient's needs and the patient's goals. So we always spend a lot of time having a discussion about what each individual patient is looking for. Then we take a careful medical history to assure that the patient is appropriate for the operation and that one's health is sound such that the operation can be done in a safe fashion. Then we get into the individual components. The first thing I like to consider is the patient's skin, and we look at the quantity and the quality of the skin. What that means is that if there is too much or an excessive quantity of skin, we're probably looking at an operation that will require some sort of removal of skin. Similarly, we then look at the quality of the skin, the elasticity and the tone of the skin. Sometimes this can be very, very good, very elastic skin, but sometimes the skin is quite damaged from, say, pregnancy or weight fluctuation, and this may be indicated by loose hanging skin or stretch marks. The next thing we assess is fatty tissue, and this tends to collect in stubborn areas that are very hard to lose over the hips, the lower abdomen, and up centrally over the upper abdomen. Some patients will also collect fatty tissue inside the abdomen, under the abdominal muscles, around the vital organs, and that's not really attainable or approachable by surgery, but is likely more genetic. And then the last thing that is looked at is the abdominal musculature, and this can play a major role in some women's abdominal contour without the patient even being aware of this change. In many women after pregnancy or a substantial weight fluctuation, the fibrous envelope that contains the abdominal muscles can become stretched, just like the skin. And sometimes that fibrous tissue is not very elastic. And if that is the case after pregnancy, that may allow the abdominal muscles to be separated, sometimes even by several centimeters. And this can lead to an extension of the abdominal cavity and also an increase in the abdominal girth. And this problem can be very difficult, if not impossible, to fix with exercise and diet, and as such needs to be repaired surgically. So in combining each of these three components, we're able to meet each patient's needs and come up with the perfect operation. I always like to start with the simplest procedure. So when going through our list of options that are available to each patient, the first thing we consider is diet and exercise. Diet and exercise will work very well to achieve a good abdominal contour in somebody who has good skin elasticity, not too much excess skin, and relatively good abdominal muscles with minimal separation. This means that they're targeting mostly fat. So if there is excess weight that a patient would like to lose, they're always encouraged to do that prior to making any decisions about surgery, because this may completely correct the issue. I've found, though, that usually by the time people come to see me, they're at the end of their rope, they're frustrated, they've tried diet, they've tried exercise, and there are stubborn collections of fat or changes in the skin that just don't seem to respond to diet and exercise. But that's always the first thing that we consider. After diet and exercise, I like to discuss what I describe as somewhat magical treatments. These are treatments for the skin and the fat that are done without surgery, that are applied externally. Thermage, cool sculpt, a variety of externally applied ultrasounds, and various lymphatic massages. I have found these treatments to be somewhat minimally effective, and in many cases there is very little change noticed. As such, these procedures are not offered at Ottawa Plastic Surgery, I have found my patients to be disappointed with the results of these procedures, and as such I don't offer them. Perhaps other surgeons have better results with them, but in my experience I have found this to be disappointing. Then we move on to surgical options, and the first and most simple surgical option to consider is liposuction. This is an operation that is designed to remove excess fatty tissue and does an excellent job with very minimal scarring, typically 3 millimeter scars centered over each hip in the pubic area and possibly inside the belly button. So the scarring is very, very minimal. But for somebody to do well with liposuction, they need good skin elasticity. The quantity of skin they have has to be relatively appropriate for their shape, and they need good muscles. In other words, we're only treating fat. If skin elasticity is poor, then simply removing fat with liposuction may help with the overall shape and size of the abdomen, but it may actually aggravate looseness and laxity in the skin. So patients who have stretch marks or lax, loose, redundant skin may be very disappointed after liposuction alone. However, liposuction is an outstanding tool, and I use it in almost all of my abdominal contouring procedures, including abdominoplasties, as it is an excellent treatment for fat, which is one of the major components of each of those three components that we discussed previously. The next option after liposuction would be a mini abdominoplasty. This is an operation that is very similar to liposuction alone, in that the entire abdomen is treated with liposuction and a small amount of excess skin is removed above the pubic area. The belly button is not moved, and only the lower abdominal muscles leading from the pubic area to the belly button may be repaired with this technique. As such, I find that a mini abdominoplasty is usually most appropriate for somebody who probably would have done well with liposuction alone, but perhaps has a tethered scar or an unusual fold of skin just above the pubic area, say from gynecological surgery or a C-section. The next option is something called a modified abdominoplasty, which is an operation that usually is not the most common choice, but every couple of patients I will see someone who's a good candidate for this. This is a good operation for somebody who has looseness and separation of the abdominal muscles extending from the pubic area all the way up to the chest, so the muscles need to be repaired in their entirety, and has a minimal amount of loose or lax skin in the upper abdomen, and has a relatively high riding belly button. What this operation entails is liposuction of the entire abdomen and hips, just like the mini abdominoplasty. It involves a slightly longer incision along the lower abdomen, and it involves release with and lowering of the belly button for perhaps 2 centimeters. If further lowering of the belly button is required to get the appropriate tone and shape of the upper abdomen, then a full abdominoplasty is most appropriate. And that is our next option, which is the operation that I do most commonly for patients who have had pregnancies or substantial weight fluctuation. The full abdominoplasty addresses skin, fat, and muscles. This operation involves a scar that goes from hip to hip above the pubic area, sort of where a C-section might go, but longer. It involves liposuction throughout the entire abdomen and hips to reduce the excess fat. It involves repair of the abdominal muscles extending from the pubic area to the chest, so the entire length of the muscles is repaired. And then the redundant skin of the lower abdomen is removed. This will leave you with that slightly curved scar above the pubic area and a scar around the belly button, which is repositioned in the better upper abdominal skin. This will remove a maximum of redundant skin, it will remove a maximum of fat, and will give you the best repair of your abdominal muscles. So if you have concerns with each of those 3 problems, then a full abdominoplasty is usually the most appropriate operation. And then lastly, we should discuss the lower body lift. And this is similar to an abdominoplasty, but the removal of excess skin and fatty tissue continues circumferentially about the hips, flanks, and upper buttocks. This will lift the buttocks and lift the outer thighs as well as the abdomen. It is the most complex operation and is usually offered to patients who have lost a substantial amount of weight, that have looseness of skin that goes all the way around the abdomen into the hips and buttocks, and is a very popular operation in patients who might have had weight loss surgery like a gastric bypass or a laparoscopic banded gastroplasty.